A normal CAT scan and MRI scan only means that we cannot see injury that has occurred following a trauma. That does not in any way, shape, or form mean that the patient is able to go back to work or play or whatever the situation may be. The fact of the matter is that the strategy to determine whether or not a patient is able to return to work, return to play, or return to school has to be based on the individual effects that the traumatic brain injury has had on that patient.
Professional athletes, they cannot take a risk of having another head trauma if they're still in the recovery process. So there's no going back to work until they're symptom-free for a period of time. Sometimes people feel it should be at least a week, sometimes longer. If you are in a position where you can tolerate some inefficiencies in your cognitive functioning, then a graded going back to work is often prescribed. You know, let's go back to work for 4 hours, 3 days a week. Then let's go to 4 hours, 4 days a week. Let's see how you can tolerate it. Let's go back. And so you do a gradation. And so the return back to work requires an understanding again of what is the patient's present symptoms, what is their actual level of neuropsychological functioning, what does their job require, okay, and is it safe to send them back?
If people push themselves too hard to go back to work or go back to their activities, go back to athletic competition after that kind of injury, and after those symptoms emerge, they will assure that those symptoms persist and just make things worse.
It's important that the physician, the patient, oftentimes the therapist, which may include psychology, occupational therapists, what have you, work together to say, it's time to go back, or it's time to go back with these modifications. And then it's important to work with the employer to make sure that if there are modifications that need to be made, that they are in place.